and then we're just gonna see right here when people can get on and join. Let's see. Do you guys see any folks joining yet on your end?
I'm on my phone, so I can't see any
You
feed.
can't see it. Are you on your phone too, James?
I'm on my phone. There is a little eyeball icon with 0 at the moment. I don't know if that's people logging in.
We'll wait the first 2 minutes for someone to join. Margaret will let me know. Let's see here. We want to make sure folks get on there. We'll probably get started in 30 seconds.
So are you going to grow the full red fro out?
I'm not. I was thinking about growing my hair out today. Okay, we've got 17 people on. We can get going. Okay, here we go. To answer your question, Eric, I might grow my hair out. My wife is saying no, make it bald again. We'll see. I'm definitely growing the beard out for sure. It's getting a little chilly here. So, okay, ladies and gentlemen, welcome to another episode of a live stream of Mental Health Marvels on the air with your friendly neighborhood Kevin Hines and my new and wonderful and amazing friends James Geering and Eric Kussin. Let's break down who is Eric Kussin, who is James Geering. Let's start with Eric. Eric Kussin is the founder and creator of the Same Here global mental health movement. We're all a little crazy is a movement about hope, healing, and recovery from mental pain. He's a tremendously effective advocate for change. His work inspires thousands, as I always say, including myself. And his mission at the Same Here movement is to normalize society's perception of mental health and make it a part of everyday conversation. He's doing a darn good job of that. Next to him, we have a co-host and guest, James Geering. James was born and bred in England, moved to the United States in 2002. He served as a firefighter and paramedic for the East and West Coast for 14 years. After seeing his fellow responders dying from a host of work-related issues, he decided to start a podcast. And I just learned today that podcast has, I think, nearly 300 episodes and is about to hit 1 million downloads, which is phenomenal. So please, if you haven't heard of the Blue Behind the Shield podcast, get on it straight away. Watch all 300 episodes. They're all crucial for your well-being. And it brings together the greatest minds in physical and mental health to the first responders and military of the world. That being said, these lessons are for everyone. Ladies and gentlemen, please welcome Eric Kussin and James Geering. And if you don't know who I am, that's fine. My name is Kevin Hines. I live with a diagnosis of bipolar disorder, but I call it brain pain. And you may know that in the year 2000, I attempted to take my life by jumping off the Golden Gate Bridge. I subsequently survived the fall, one of only 39 individuals in 83 years to do so. I'm very lucky and blessed to be alive. I thank God every day for every moment I get to walk this green earth. Every moment I get to exist is a beautiful moment. And I appreciate everyone around this world, every place I get to go, everything I get to do. And I appreciate both of you. Let's get it on and popping. Let's get it cracking. And as our friend Chris Cuomo would say, let's get after it. Okay. So first of all, I want to go to my good buddy, Eric. Eric, can you introduce yourself, talk a little bit more about the work you do for those who didn't watch the first 2 episodes of Mental Health Marvels on the air. I want to hear your thoughts. And then if you could bring it over to James and his story, that'd be great.
Absolutely. I'll give the much Cliff Notes version of it. But we talked a lot at the beginning about I had a childhood filled with trauma, and I didn't know what trauma was at the time. I watched my older brother for a 20-year period with cancer twice, septic shock, falling out of a Jeep, landing on his head, cracking his head open, losing partial vision in his eye, kidneys failure, kidney transplant for my father, and then subsequently after that, 3 of my close friends passing away before turning the age of 30. And what happened was I was working in a career of professional sports that I loved so much that I didn't realize these things were building up inside of me and eventually were going to topple me over because I had this distraction, an important thing for us to talk about, especially with what's going on today, this distraction of a job that I loved. So for me, I was the smiley guy. I was the one who was happy. I was enjoying what I was doing day to day. And that was until I just completely started to dysfunction, spend 2.5 years laying in a bed, staring at a ceiling, not watching TV, not listening to the radio, essentially being a guinea pig for all these different treatments from 50 different psychotropic drug combinations, TMS therapy, and then finally shock therapy. None of those things worked for me. I finally learned about how trauma affects our system, how it builds inside of us like plaque does for our physical health. and decided that we need to look at mental health from a very different angle as a society. It's not just about disorders. It's not just about the 1 in 5 that have this thing called mental illness. Mental illness is a place on a mental health continuum that all of us are a part of. So the whole idea behind the Same Here movement is having people in the world of athletics, in the world of entertainment, in the world of music, first responder world, who I have many friends in, all come together and share that we all have a Same Here story, because Same Here means I've been through challenges, you've been through challenges, not I've been diagnosed with this thing, you've been diagnosed with this thing. And if we can get mental health to be talked about more, about all the challenges that we all face, that's common to all of us. James was joking a little before about how many people he has on his show, because there's so many people out there with amazing stories, because we all face challenges. That's what it's really all about. So now that I've taken the stage for a bit, James, please go and introduce yourself.
Well, firstly, thank you for having me. I mean, like I said, normally I'm the other side of the microphone. I'm way more comfortable that way. But yeah, from a first responder's perspective, as I mentioned in the intro, like there's so many groups of people that are going through stuff, and there are some unique elements that are really challenging first responders. We always focus on what we see, but that's actually really, I think, a small part of the issue. But there is an epidemic of suicide and mental ill health and addiction. In my profession, we lose basically double the amount of people to suicide than we do to line of duty deaths, which means, wrecks and dying in fires and all those things. So I knew I didn't have the answer, but I knew there were some incredible people on planet Earth that did. So my goal was to collate all those people. Just an interview with Margaret and Kevin today, which I'm going to put out for my next episode. So I'm really excited about this discussion, because this is it. There are some great people that have been fighting for a long time. Obviously, Kevin's one of them. I'm much newer to the game, probably the last 5 years, but this is how we do it. We don't sit back and wait for people in majestic buildings to change things. We roll up our sleeves and get it done ourselves.
James, on that note, can you talk to us about your journey, first as a stuntman, and then your journey as a firefighter, and give us the parallels in that situation, please.
Yeah, well, it was kind of funny, and a few people, if they've ever heard me talk before, I do talk about this, but basically I wanted to be a fireman since I was little. I want to be a stuntman since I was little. I want to be a doctor since I was little. And when I went through one of the kind of childhood medical checkups, they told me I was colorblind and I could never be a fighter pilot, could never be a fireman. And when you're young, you listen to the dude with the white coat and the stethoscope around his neck, because surely they know everything. So I just discounted it. So I kind of fumbled my way through, adolescent, early 20s, trying to find out what to do then, because that was kind of my dream. And so I ended up finding myself into stunts via drama school. I did martial arts and stuff. So got into the stunt world. And then that ironically led me to America, which led me back into the fire service when I'm not the sharpest tool in the box. About 27 years old, had an epiphany. I can see colors. Maybe I'm not colorblind. And then went into fire service, and that was it. So, but since then, I've been doing those two professions pretty much parallel, apart from the last few years. But I just retired out of the fire service to focus on this, because I think this has what's the word? I forget the term now. But anyway, you can magnify the amount of people that you can help doing something like this versus sitting in the back of an engine or a fire truck or an ambulance and treating one patient at a time. So a force multiplier, that's the term I'm looking for. But now I have some time. I just found myself back in the stunt world. So two very different parallels, two very different unique set of challenges with the stunt industry. Physically, when some of these men and women get hurt, they are not supported by the people that they work for. I had Olivia Jackson on, who was a lady that was almost killed on one of the movie sets, one of the zombie movies, and again I'm blanking now the name. Resident Evil, one of the Resident Evil movies, and is still to this day fighting just for the compensation of almost dying and losing an arm. So even though they're very different, and you know what you're about to do in stunt world, you have no idea what you're about to do in the first responder community. The level of mental and physical preparedness is definitely parallel.
And Oh, go ahead, Eric, please.
Yeah, James. The interesting thing to me is so I've worked up a bunch. I'll give a shout out to the folks who work up in Vancouver, British Columbia, and have a whole mental health consortium with first responders up there. And when I was asked to present up there, I was thinking, how do I hook these guys in? And so I put up 4 pictures and 4 very different looking people: Sydney Ayalo, Calvin Desir, Jeremy Richmond, Austin Eubanks were their names. No one really knew who they were, didn't know the names, didn't know the pictures. And then I hit a button again and it said Parkland, Columbine, Sandy Hook. And then I hit another button and it said suicide 1 year after event, suicide 1 year after event, suicide 5 years after event, suicide 20 years after event.
Wow.
And the point I was trying to make there, and this is why I'd love to get your take on this, because you talked about the impact that you can make as a first responder in this space now, sharing stories. What I was sharing with the first responders in that
step onto that diamond on that training yard day one, they show up in shape, most of them. I think mentally they are pretty resilient. The first thing at the front door that I've learned now is that many first responders in military and associated professions are in that profession because maybe they went through trauma when they were younger. Maybe they were abused sexually, physically, around drugs, around violence, and they want to be the protector. They want to stop that cycle. So that was one thing that I was totally blind to until I got into that. So you've got people that are already carrying a huge amount of baggage in with them.
Mm-hmm.
Then when the things that we see, there's no question that they add up. And you have a mode when you're on a call, and I've written blogs about calls that I've been on and kind of lessons learned. And they're horrendous. Little kids that, are disfigured now and obviously passed away, and people that throw them from cars and burned in fires. I mean, that's not normal to see that. But you are in a mode. At that point, you're in rescuer mode. And that's the issue, is at that point, you're doing well, but it's after. It might be, a few hours, a day, a week, years. But eventually, those are all gonna need to be processed.
Oh, we just James. Okay, let's get him again.
There we go.
There we go. All right, James is back on. Hi, James.
Hey, sorry about that. My app on my phone is not behaving. I can't see you guys, but I can hear you, so we should be good.
Okay. We're okay. Well,
So can I finish up that question, Kev? So, and I know we just had technical difficulties that are going across Facebook right now.
Yeah.
So I don't think it's limited to ours. But you being entrenched in that community for so long, James, what do you hear from men and women in terms of willingness to open up, just because of some of the penalties that come potentially if you do open up?
Yeah, so what I saw early on was some of that shaming, some of that rub some dirt in it, some of that, well, if you don't like it, McDonald's is hiring BS that you hear. And it really made me take a step back and look at why is that in the first place. And you look at our generation, here we are, 3 men roughly the same age, and we were raised on, Terminator and Predator and Rambo and all this stuff, Chuck Norris. And so that kind of Hollywood facade has defined what men should be, and men don't cry. And I talk about this a lot on the podcast. You want to see real men, and I'm just talking about men specifically at this point, and you watch the Brothers, and you watch the real men of the 101st talking the beginning and end of each episode, and they're choked up 60, 70 years later. That's what happens when you see trauma, and that's what it should be. So when we have this shaming element to it, or the fear, like you said, of an officer losing their weapon because they're diagnosed with PTSD, it is terrible. And the way I always equate it is like a back injury. So say I hurt my back, which I did, ironically, a few years ago, and I keep it quiet because I don't want you to stop me being a fireman. And I'm afraid that if I tell you I hurt my back, then you're just going to fire me or take away my ability to be a firefighter rather than send me to somewhere where I can get better. And so I keep it quiet. And then one of your children is stuck on the 10th floor of an apartment building that you live in, and I break on the way up, and I go down. And that way, my men and women are now pulling me out instead of your child, and your child dies. So it's so backwards. What we need to do is have an environment where these men and women feel like they can reach out, because as the 3 of us know, the other side of this mental health crisis is resilience. And you are stronger and you are going to be better at your job and you're going to be more empathetic with people that you meet because you've been there.
Yeah.
So putting a barrier up, creating this fear of reaching out is not only contributing, obviously, hugely to suicide, but also just an ability to be a good first responder.
So if I'm paraphrasing that, and then please take over from here. If I'm paraphrasing that, James, yes, there might be some penalty that goes with being open about what you're going through in the short term, but what you gain in the long term from a resiliency perspective, from a perspective, let's use the term perspective, and how you're able to use that to be a better first responder because you healed yourself and worked on yourself and experienced that. It's worth opening up and having that brief period where, to your point with the analogy, when you threw out your back, take the knee, allow yourself to take that time to heal because you're going to be that much better down the road.
Yeah, you as an individual and then your employer, your agency needs to create an environment where it's not, if you say it, you lose your gun, period.
Yep.
Rather than there is a process. And it doesn't matter you lose your gun because you're going to be off duty anyway for a few weeks while we send you through counseling and get you out the other side. So, I disagree with the whole PTSD automatic weapon loss anyway,
Yep.
because, unless you actually have specific suicidal ideation, there's a big disconnect between that and someone who's just going through some trauma they haven't processed.
Yep.
But yeah, so it's a double-edged sword, but we definitely need to be able to take a knee, and we need to give ourselves permission to take a knee, because this image of what a man does, what a soldier does, what a police officer does, if it's any Hollywood figure flashing through your mind, disregard it. It's complete BS. You have to think about what you do as a profession and longevity and resilience. But that also needs to be encouraged in your agency, an environment not only to be able to reach out, but then some great resources for you to easily transition to. There's a psychologist I've had on the show, Dr. Tanya Glenn, who's worked with fire and police for a long, long time. If she's your go-to person, she's going to understand, exactly what you're going through. They've got EMDR and all these other great practices, and you're going to be
Yep.
back in a
Yep.
few weeks, a few months, whatever it is. And you're probably then going to be a beacon for other people that are hurting, and they're going to use you as a resource. How do you get there? So to shame people into not reaching out as an agency, or to feel that you can't, those are two elements that we have to change 100%.
I love that. I love that perspective.
Absolutely. James, well said. Thank you very much for that perspective. We appreciate it. For the people that saw us drop on the live feed and come back on, and for the folks that may not have seen, we lost James.
You can keep explaining maybe while
for the
try
folks,
to get him back.
Yeah, for the folks that lost us out there, I want to just go back over our the intro of James, to know who he is and what he's about. Eric, we've had on the show last night, so you know Eric's story. James Jeering was bred in England, moved to the U.S. 2002. He served as a firefighter and paramedic for the West Coast for 14 years. After seeing his fellow first responders dying from a host of workload issues, he decided to start a podcast. The Behind the Shield podcast has now had 300 episodes, 1 million downloads. So please check that out. We're waiting for James to come back on. We'll just be chatting amongst ourselves with Eric for right now.
I mean, I think, it's interesting to dive a little bit deeper into what I was discussing there with James, just so that the rest of the audience can understand it, because I didn't know much about it until I started working with my first responder friends through the work that we do. And, there's this concept of getting your gun taken away. So in a lot of first responder communities, if you're diagnosed with something like PTSD, there's James back right now, it's taken away from you. And so I think what James is explaining there is this resiliency that gets created in a place where, if you think about mental health, I think a big reason why PTSD is being changed globally from the term PTSD to PTSI, post-traumatic stress injury, is because the more we understand about trauma, the more we understand how it impacts. And when I was describing that first responders are a great microcosm for the rest of society because they're seeing more trauma than anyone else. So proof positive that trauma affects us is that if you could get a back injury, James is saying, he didn't say it now, but I'm putting words in his mouth. You could go to a physical therapist, work on your back, and get back where your back is back in shape and you're back on the job. Okay. I'm using a lot of backs there, obviously. At the same time, when you go through traumatic event, James used EMDR. For those who are watching, don't know what it is, but you know, this process where you go to a therapist, you're either moving your eyes back and forth, or there's vibrating what feels like eggs in each hand, and it's allowing this movement between both hemispheres of the brain to reprocess traumatic events as not feeling as emotionally strong as what they were and how much they held us back before. What James is saying is you can rehab from these things and get to a better place. And I think that's what the three of us each have experienced. And that makes the concept of trauma, that makes the topic of trauma a lot less scary to people. It makes them understand that it's okay for me to ask for help, because I actually have hope when I ask for help, instead of me taking a pill and praying and that being the only thing that gets me better. I can actually work on what's going on up here and in my central nervous system the same way that I could work on my knee or my back in James's case if I'm injured in that way. So hopefully that's helpful, James. I was just adding that as we were waiting to get you back on so people understood what you were talking about with the gun being taken away and the PTS or PTSI, how we describe it now.
Yeah. Just I'm sorry, Kevin.
I was going to say that goes back to us getting to the root of the problem and affecting change in our lives based on what we know to be the start of the pain. And as I continue to say, I'll never stop repeating it. There's a pain shared as a pain of past. And as we recognize our traumas as very legitimate and real, and that have changed our side, they change our brain, they change in our gut, they relate. There's a symbiosis that occurs. We can really be more effective in our treatment, whether that's clinical treatment or self-actualization and helpful tools to better your brain, mind, and behavioral well-being. We can change our outcome based upon how much we are self-aware of our struggles and how much we recognize our true value and that we're worthy of people's time and energy to find recovery and to live and to be here tomorrow. James, your thoughts on all that?
Absolutely. Well, I was going to tack on with the back analogy as well. I think this is where it helps with people who struggle with this facade of weakness when you reach out. Is, for example, say you are a police officer, a Navy SEAL, a firefighter, a medic, a dispatcher. Understanding that when you come out the other side, you're going to be even stronger than you went in, I think is a big thing. So for me, when I did hurt my back, I had a back injury about 5 years ago now. When I went down that physical therapy journey, my question to myself was, well, why did I hurt myself? And so I found areas of imbalance, problems from sitting. I mean, we didn't think it's a fire service is sitting a lot, but we do. We sit on the ambulance, we sit writing reports, we sit doing a whole bunch of stuff. And so I genuinely was stronger. By the time I rehabbed all the way through, I was a stronger, better firefighter than I was before I hurt myself. And I think that needs to be kind of underlined as well, is when you ask for help, you're not coming back as like a China doll version of who you were.
Yeah.
When you do the self-work, you're going to come back much more resilient. And like I said, you're then going to have people coming out of the woodwork telling you that they're hurting too. And now you're a beacon of hope for them because they've seen you come out the other side. So don't see it as taking a step back. You're going to be advancing physically and mentally by doing this.
I think it's something that the three of us have been fortunate enough to experience. I say fortunate because when you go through this crash that the three of us have had at different points in our lives, difficult things that we've been through, that path that we then change and go down another place, we come back and things seem easier to us than what they were like before. So if I go and I talk in front of 3,000 people out of college, people say, aren't you nervous to talk in front of 3,000 people? I see Kevin doing it all the time. And I say, I'm not nervous at all, because you know what the hardest thing in the world to me was? The hardest thing in the world was laying in a bed for 2.5 years where it felt like my brain was being dragged across the pits of hell. Like, that's something that I got over. So because I got over that, presenting to 3,000 people is nothing compared to that. Now, I wouldn't have had that perspective if I hadn't gone through that. And so it's so great to hear it from you, to hear from someone who's been on the front lines the way that you have. I guess I would transition that into asking you, James, with what you're hearing, what's going on now with everything Corona related. And I've asked this question to my friends from so many different areas. So I'm curious, whether it's in Central Florida, whether it's friends that you have in the first responder community generally. One challenge that I'm hearing is that a lot of folks, either in firehouses or in police departments, are having to self-quarantine because they were exposed. So the number of people in the force is diminished. And so that means that people are having to work overtime, which is not a great thing. That's one challenge. The other thing is, this fear I think that people have being at home right now of what is happening, where their anxiety levels are higher. What are you seeing out in terms from your friends and the folks who are still working on the front lines in terms of, are there more calls coming in because more people are home? Are there more calls coming in because there's more anxiousness? Is there more, to your point, of overextension of some of the folks who are out in the front lines working because other folks are having to be self-quarantined?
Yeah. So my first honest answer is I really haven't spoken to many people. And I think that probably means there isn't a zombie apocalypse going on.
Good. That's good.
However, so there was a video I just shared a few days ago of a Miami Beach council member who was suggesting that they forcibly expose all first responders to the coronavirus to, as he said, take one for the team.
Wow.
So therefore, then after, if they survive, then they are resilient and then they can go on and do their business. And here, not only from common sense, that's a horrible idea, and it just totally underlines why putting people like that in positions of power is terrifying in the first place. But as I mentioned, these first responders, as resilient as they are and think they are, these shifts are breaking them down, and their immune system is compromised. So they are actually probably a lot more at risk than your average office worker. And to kind of underline that for any male first responders, if you have a testosterone that's way lower than what it should be, that's sleep deprivation. I can tell you that right now. So your immune system takes a giant hit from that. So the fact that we've got people self-quarantining and then requiring whoever's left to work even more, there's going to be a Jenga effect where it's all going to come crashing down. Me personally, I understand slowing the peak of this. I totally get it. Obviously, I understand keeping people who are compromised in places where they can get treatment, ideally away. I don't know really how you truly keep people away from viruses. Otherwise, we wouldn't have a flu problem every year.
Mm-hmm.
But yeah, the people that we're relying on, the doctors, the nurses, the first responders, are these shift workers who in themselves are compromised and are probably more at risk for more severe symptoms than a lot of these people. So what I'm seeing is a whole bunch of healthy people quarantining, having the time of their lives, obviously financially concerned about them being stopped from going to work, and the load being put on the medical and first responder personnel and dispatchers and everyone else in that group. And I think that, it's an unnecessary strain on them. I mean, not downplaying it, and I'm not an epidemiologist or any sort of expert, but we've had just, I think, 112, 114 deaths from this so far in the US. And the same in China. These were immune compromised, like chain smoking elderly Chinese men. And, right now we're seeing like nursing homes where we have fatalities. And the reality is these men and women are probably going to pass away from something. It's like the person with AIDS,
Yep.
Whatever's around is going to kill them. So I think there needs to be more of a middle ground, common sense approach to this, because we're putting a huge demand on the very people that, let's not forget, while this is going on, there's still strokes and heart attacks and car wrecks and house fires, that we need these people to be resilient and strong and able to respond. So again, that pendulum of rest and recovery, instead of shifting towards a more healthy tactical athlete, is swinging even further towards destruction. And that's going to have a toll mentally and physically on these men and women that we're asking to do this job.
Absolutely.
When you think of the first responders in the world, that there's a huge toll they're taking with adrenal fatigue, and being at such a heightened state of mind when acting on a crisis, and being the first responder to an event, a fire, a domestic dispute call, something that's a violent occurrence in the community, whatever it may be. They already have that adrenal fatigue from working so many hours, working so hard, and now we're pushing them out to work even harder in longer shifts, more overtime, because like you said, Eric, so many are now self quarantined and have to be. So I think that what I'd like to do now is, since we went for about 30 minutes with the other one, about 18 minutes with this one, I think we'll wrap it up here. What I want to do is I want to give you guys an opportunity to give your best of hope to the community out there struggling with the anxiety that comes with COVID-19 and the coronavirus, struggling with first responder fatigue, and how do we look forward to moving forward in a time of crisis like we're in right now? I'll go James and then Eric.
Okay, well, I mean, I think an observation just globally for the coronavirus is we need to be cognizant of the fact that that tribal element that people had that was very positive for their mental health, whether it was their church, their CrossFit gym, their yoga space, has now been taken away. So we need to be very cognizant of people who don't have that. I'm sitting here now in a house with my two sons and my wife. I'm golden. I've got a dog, you know, I mean, I'm so blessed. But there are people right now quarantined on their own in an apartment, in a nursing home, you know, who knows where. And so we first need to look out for those people. And I think, you know, just overall from this is you see the videos of people fighting over toilet paper, all this ridiculousness, but we need to pull the positives out of this and maybe kind of reset some of the mentalities you have. Maybe you're a workaholic. Maybe, you know, you've constantly got your nose in your cell phone, and be more present with each other. So I think there are some very positive things that come out of this. I personally think we've swung a little bit too hard one way, but that's just me. Who am I? I'm just a fireman. But I think that's it, is that making sure that while there is, I mean, it's in the word, it's isolation, that we are taking care of each other. I don't think this virus is going to wipe out the US. But the one perspective I've had, though, is there's been no discussion really on the health of the nation and therefore resilience to any sort of virus. So maybe this would be a good time to look at what we feed our children in schools, what we spray on our food, how we treat our cattle, and put a higher priority on nutrition and fitness and immunity, so that the next thing that comes, we can be like, well, you know, we're a lot better prepared because our people are healthier.
Yep.
I love that, James. Fantastic. Eric, can you break down your last thoughts?
Yeah, of course. I mean, I learned a lot from hearing from James, and I want to build off of that. Is that my hope coming from this, from an optimistic perspective, is you've got three dudes here as a microcosm of other people in society who go through things mentioned before. After you go through things, then gain a greater perspective, become more resilient, become better at what we do. I think it unfortunately might have taken something like this, like the coronavirus, which affects everyone in the world, for people to understand that factors in our life that are stressful and traumatic affect this thing that we have that's called mental health. And instead of waiting for it to hit this critical point, like it has for each of us at certain points in our life, to then finally realize we need to take care of these brains, these central nervous systems, these connections between our brain and body that we have, this piece, this time period in our life could be a revolution towards people understanding, look, the three of us would not have been on a video webcast, if we call it right now, had it not been for this period of time happening. And so how beautiful is that this happened, but it allows people to hear our personal experiences, take that in the context of what their experience is right now with what they're going through and the fear and the anxiety that they're feeling because there's something situationally in life happening. And for all of us collectively to say, wow, there's something there. My mental health can be affected, and I don't need there to be this genetic predisposition for this particular
ailment in order for me to worry about my mental health. It's about all the things that go on in my life and what I experience. Got it now. I'm going to work on it and listen to people who've been through it so that I could be resilient and healthy myself. So that's my hope for everyone.
Thank you so much, Eric. Very well said. Really, really important information to hear. On my end, I think that we need to focus right now on those we love, those we know, and those that need help who we maybe don't know so well, and give back to the best of our ability in any way, shape, or form we can. I want to give a huge shout out and thank you to my wife, Margaret Hines, and Lauren Green for their work on the back end of this live stream. I want to thank all the people that viewed the live stream, the first launch tonight, and the second viewing of it right now, and all the folks who will watch it after we close. This has been an episode of Mental Health Marvels on the air with James Geering, Eric Kussin. Everyone go home tonight, or everyone that's home tonight. Be well, kind, compassionate, loving and caring and empathetic to everyone you come across, no matter their behavior toward you. You don't know what they're going through at home and on the inside. And be well and be here tomorrow. And every single day after that, you're valued, you're loved. And if nobody else says it today, we love you. We want you to stay. Be here tomorrow. Thanks, guys. Take care.
Thank you.
Thanks, guys.